Okay, today Brad and I are going to show you how the hang and twist might help your back pain.
This is not the peppermint
And it's
twist.
not the twist and shout.
Okay.
Bob and Brad, the two most famous physical therapists on the internet.
Okay, first off, I want to say, Brad, that we like the hanging handles because it allows you to keep your back flat against the wall. However, if you don't have hanging handles, you have a pull-up bar or a rafter, we can have you first try that to
Right.
see if the decompression helps your back pain.
Right.
So basically, what we're trying to do is lengthen the spine. So if you take your end, Brad,
Oh, yeah.
yeah, and I take my end, and
So here's the head, and
Right.
so the hanging. You're hanging up here, and I'm going to support the upper back,
Right.
as it like my arms do.
the weight of his legs will actually pull a bit and hopefully separate the vertebrae just minutely.
Right. We're just decompressing it just enough to get some more circulation and imbibition, perhaps even.
So
Bob.
yeah, at the end we'll go over which back injuries this might help.
Say no more.
All right, Brad, why don't you demonstrate first just straight decompression?
Right. So this is what we're talking about against the wall, or if you have a pull-up bar, you have to be able to grab the handles and still have no force to your back.
Right.
Because you want to go slowly, you can see I'm bending my knees, slowly putting traction or force the decompression through my spine.
Relaxing the abdomen.
Yep.
You know,
Yep. Right there. And that can be a little difficult for
it
some
brings
people.
us the first rule, Brad. No pain.
Yeah.
Absolutely no pain. Should feel better.
Yeah, and right now mine feels better. So the wall actually acts as a little friction and a reminder to keep straight. And if you're touching with your butt and your shoulders, you know, in your head, you know your spine is neutral and good.
All right. If that feels good for a couple days,
Oh,
why don't
yes.
you try the twist, Brad?
Okay, now I'm still not full weight bearing. I still have
Right.
50 to 75%. And I'm going to do the twist with my toes on the floor because I'm not ready for it yet. We'll
Right.
just make that up. And I'm going to rotate this way.
Just to the right.
Yep. And if that hurts, then I'm not doing that anymore.
That's right.
Go to the left.
Absolutely. Pain be your guide.
Yep. Now, if it hurts to the left too, well, you wouldn't go that way either. You're just hang as long as that feels good.
Right.
But let's say, and this is pretty common, one way may be uncomfortable, but the other way, it's okay. So then you'll just go to the comfortable way, always keeping pain should
At
feel
bay.
good. Keep it
Right.
at bay. And the more you do it, if it feels better, you're doing good. If it happens to get worse, the more you do it, you're going to stop and
And
take a
then
break.
eventually you might go revisit going to the right.
Yep. And oftentimes, after you loosen it up to the left, that painful right will become less painful and more mobile. And so you just work with it slowly. And this may not happen in one
Right.
visit. It may come, you're doing this maybe for a few days before you get that. But you have to follow the rules of it, must make it feel better.
And you may never get to the point of taking full weight on the arms.
Right,
Yeah.
right, yep, and that's okay.
That's
As long as
okay.
it's feeling better. And then
Right.
also make sure it feels good while you're doing it, but then get up and walk around and make sure it feels good afterwards, because sometimes that can be a problem.
Now-
Usually not.
Brad has spondylolisthesis.
Yeah, it's a mouthful.
So what do you do for it, Brad?
Yeah, and I think people with stenosis in the lumbar
Sure.
spine may find
I
this
like
helpful.
this one too.
Just put a stool in front of you. This one happens to have 2 levels, which is very handy. I'm going to go down to this level.
Again, that's where the wall comes in handy.
Yeah. Now, if I do push my butt to the wall, it extends my back, and after a while, it's not comfortable. But if I go the other direction and I do this, it actually flexes the lumbar spine. That feels better. And actually, for me, this even feels better yet. So
Sure.
when I do this at home, I do bring my back forward like this. I don't always use a stool because I don't need quite that much a lot of times, the way it's set up in my basement. I don't need that, but oh, it feels really good now.
So this might give you relief for 20 minutes and
Mm-hmm.
will allow you to walk, which you normally can't because you have too much pain.
Right. Yep. Again, work this with how it feels and what you do afterwards. So if you can walk for a time afterwards on a flat
Right.
surface, not up hills or
Good practice.
not out in the barnyard or
Okay,
whatever.
we'll talk about the types of back pain this might help at.
Oh, yes.
All right, the first thing it might help is if you have sciatica, where you have a disc problem.
Yes.
So you have a disc that's actually bulging out
I have
and
the
pushing
pointer.
on the nerve.
Yep, right there.
Right. So by pulling the bones apart, you can actually get a centrifugal force, Brad.
Centrifugal.
Yes. And you can actually suck the disc in.
What book were you reading?
Right. No, that was years ago. I read
Okay,
that.
I'd call it a vacuum, but whatever. The
Sure.
bulge goes in and gets away and decompresses that spinal nerve, taking the sciatica away.
Right. And the twisting might help readjust
Yep.
the disc.
Yep, and it can open up that foramen or the
Right.
hole where the nerve goes through.
But again, follow the guidelines. No pain, no increased pain, no
Should-
increased leg pain.
Yep, should feel better.
All right. The other thing this might help is if you have osteoarthritis, because you're putting pressure on the joints, they're getting jammed together, and by spreading them apart, you might give some relief to those joints.
Right. A lot of people aren't aware of, but there's two facet joints at each vertebral level,
Right.
and that's where the arthritis
Lots
is.
of joints.
And this separates those.
Right.
Is there
Third-
one more?
No, there's two more.
Oh, good.
Yours.
Oh, yeah, spondylolisthesis. This is something.
What, you sure already?
Yep. Again, I think with spondy, it's going to be some people it's going to help and some
right.
people not, depending.
Same with spinal stenosis.
Right. Yep. So again, follow the rules. That may do wonders
And-
for you. Or it may not be ready for it.
And the final thing.
Oh, yes.
Is possibly if you have really bad posture, this is going to help straighten you out somewhat. And it's a good thing to do throughout the day. If you have a pair of hanging handles in your office, you can actually straighten out and you actually can reduce your pain.
Well, you can put them in your bedroom.
I
Don't
did.
You did. Mine are in the basement, but yeah. Also, actually, what we
My
learned
wife
this
is
from.
thrilled.
Yeah, just put them all over the house.
Yeah.
They're good for the shoulders as well.
Right.
That's another video,
Yeah.
but we do have some videos on hanging for the shoulders. So
All right. That wraps it up, right, Red?
what I really want to say this, Bob. So
Okay.
don't go away yet. I really want to say you can't go wrong with hanging.
That's right.
Yeah, you can't go wrong. So just be careful though, and
Hang and
Yeah.
twist.
we digress. Let's
Aye.
cut her off. Cut her off, Tanner.